I just want to tell you guys, whenever we started this conference, this was one of the panels that I was most excited about, was because, we are here in a virtual environment due to the COVID-19 pandemic. Normally, we would be at the Breakers in Palm Beach. We would all be, doing our thing down there and enjoying these sessions in person. We'd be walking through a real exhibit hall. And quite honestly, most of us would be looking forward to going home by now, right? But instead, we've been put in this new environment, and we've all been forced to adapt and to change the way that we do business, change the way that we help others, change the way that we get education. And so I really wanted to bring a panel to talk about the different changes that we've seen, not only in a level of care or in the business development office, but in all different levels of care, and see how it related to our outcomes. And so I'm really excited to have our panelists here today. I'm excited to have Joanna Conti, Dr. Brian Sanford, and Chris Collins here to talk about the different impacts that they've seen at different levels of care and how it's impacted our outcomes. But also remember that this is a collaborative session, and this is for the attendees as well. If you have questions or challenges that you've seen in your own practice, please put those in the question and answer, and we'll ask them live here to our panelists. Also, if you have some solutions that you've walked through and adaptations that you've made, please feel free to share them, and we'll announce them too, and we'll walk through that together as a group. So with that, I'm going to get out of the way. I'm going to turn it over to Joanna and to do introductions. And thank you guys so much for being here. We really appreciate it.
Thanks, Glenn.
Yeah.
Thanks,
Glenn, this has just been a fabulous conference. Thank you so much for putting this on. It's just really been fascinating. I've attended a number of the panels and discussions and presentations, and you've just done a fabulous job. So we're going to wrap this up with a bang. So I want to introduce now Dr. Brian Sanford. He is CEO of the Arbor, and Chris Collins, who's Director of Compliance for Victory Bay Recovery Center. And I'm going to ask each of them to just spend a minute and just introduce themselves, their center, and talk about just overall, what changes did you implement as a result of COVID, and kind of just give us a quick timeline, and then we'll dive deep into the discussion and start asking questions. So Brian, would you like to go first?
Sure. Thank you very much, Joanna. I am Brian Sanford, and I'm actually the Executive Director, CEO at the Arbor Behavioral Healthcare. And at the Arbor, we have a full continuum of care. We have residential all the way through sober living and advocacy. And we actually talked about this last week. What impact has COVID had on our facilities? And I can speak personally. I've worked in mental health and chemical dependency for about 30 years. And so I've been doing it for a while. And I have to tell you, the second quarter of this year, April, May, and June were by far the most difficult, challenging quarter I've ever had working in this industry. And it was a lot. And what did we have to change at the facility? The level of change that we engaged in is unprecedented, and we had to change everything of how we do services. And it started in early March, and I'm in Texas, by the way, in Georgetown, Texas. And we actually started at the beginning of March, and it started with starting to lock down the facilities as far as having visitors come in. And so we were trying to minimize the spread of COVID. And it's interesting. We have documented every single change that we've made during that time. And it's very interesting. The lockdown process went all the way through March, and by the end of March, we were completely shut down at our residential, where there were no visitation. Clients were not allowed to go to meetings. There was no outside activity at all. And And so that was really the first phase. And then the next phase is we had to develop systems around how to quarantine incoming clients and how to test incoming clients to prevent individuals coming into our system and potentially affecting other people. And so that was really the next phase. And along with that is what we started to see is the stress level. We did see stress level increase, like you were talking about, Joanna, with clients, but the more profound stress level increase was with families and the staff. And that's where we started getting requests for staff members to furlough, and we started to see that staff were unable to complete job tasks that normally they were able to do, but because of the pressure of COVID on top of everything else, many of our staff members really became overwhelmed and unable to perform regular job duties. So we had to address that. And I would joke around about my job turned into talking people off the ledge. And that included clients, staff, and families. And we started to implement a lot of strategies around all three of those groups to mitigate increasing anxiety levels. And so that was a really big push. The next step was, of course, the PPP loan, the financial aspects, because beginning in April, we saw in our residential services about a 33% decline in census. And that lasted really through May, and we started actually increasing, building census again in early June. And so we were pretty optimistic going into June. And then we had our first positive case, client case, and that killed our momentum. And throughout this whole thing, the biggest fear that I had was if we get a positive case in our residential program, it'll shut it down. That was my fear. And I had some nights of struggle with sleeping because of that fear. And then we had our first positive case. And it was amazing as far as how the staff stepped up to deal with that. And we were able to navigate that first positive case. We, of course, included our local health department in that, and we made it through it. And since then, we've had 7 more cases. We've had 4 staff members and a total of 4 clients. And we've developed systems around all of that. So now, if there's a positive case, it's not this big traumatic event. We know how to deal with it. We have protocols in place and we deal with it and then continue to move forward. And so what we've seen is initially the anxiety was through the roof. And as we've progressed in this and developed systems to accommodate the pandemic, the stress levels have started to, I wouldn't say they've declined significantly, but they've started to stabilize. They're not increasing anymore. And that's true with our clients. Our clients actually recovered faster as far as stress levels than families and staff. Families probably were number 2, and staff have been number 3 as far as really supporting them in learning this new way of providing treatment. So
Brian, what has been the big impact? What are families so concerned about? Everyone is very concerned about COVID, but I didn't even realize that they were another group that you had to spend a lot of time working with.
Oh, the families were so much more concerned about the impact of COVID than the clients were. It was profoundly more concerned. So we had family members that we had to develop all kinds of systems. One system that we did develop that has really helped is we started doing a family program every week, a Zoom program. And that initially started to deal with anxiety that family members were having around their loved ones contracting COVID. while in treatment. And it's really turned into this beautiful, it's absolutely, I do that group every week, and it's one of my favorite things to do. And it's turned into this just incredible support system. These families are supporting each other, and it's transitioned away from COVID back to recovery related issues and their progress in their own personal recoveries. But in the beginning, it was COVID, COVID, COVID. So, so it's interesting that we've started to, it's the new, we don't do treatment the way we used to do it. And this is the new way. Now, I don't know what it's going to look like in the future. I don't know if we're going to go back to the way it was before COVID. I doubt it if we're going to completely go back to that. But it is the new way. And throughout this whole thing, and I'll shut up, throughout this whole thing, we've also seen a lot of heroes. Our staff, there have been so many times where our staff have gone so far above and beyond expectation to jump in. For example, the first case that we had, many of us were at the facility for, 15, 20 hours dealing with that situation. And we had several staff members step up. And so it's not just a stressful story. It's also a story full of examples of people going above and beyond and being heroes. So it's been very difficult and very beautiful at the same time. So.
All right, Chris, I'm going to have you introduce Victory Bay to everyone who's listening and talk a little bit about your history with what changes you had to implement as a result of COVID and how that went.
Sure. Thanks, Joanna. Hello, everyone, virtually. This is a little different than what I'm used to, where I can't see all the attendees. So that's another adjustment. I feel like we're constantly adjusting to new tech etiquette. So I feel weird speaking to people I can't see, but hello, everybody. I'm Chris Collins. I am a compliance officer here at Victory Bay. We have a small health system called Advantage Behavioral Health. I'm a Philly guy, but we're based in South Jersey, right across the river. So we do mental health and SUD. So I'm going to speak today just, germane to the SUD program, which is our continuum of care is IOP and OP. We hovered around between 80 and 100 census at our IOP facility. So a little bit different than Brian, a little more zoomed in to the outpatient level. Just me personally, I'm an attorney by trade, and I'm also a self-disclosed person in recovery. So I transitioned to this field from the law profession. I work on the regulatory piece, and I manage our policies and procedures here, as well as our quality improvement program I developed from the ground up. So I was very heavily involved from the beginning with the COVID process, which I had to sort of scroll through emails and look back at all of our policy revisions, kind of like Brian was saying. We have, we revised things so many times over the course of the 10 months. It's kind of hard to forensically go back and see where it began. But I think I pinpointed around early March too, was the first tricklings of emails of, hey, we got to develop something. And I think around the first week of March, we created a work group, scheduled twice a week meetings here at our facility. Basically just bringing in the head medical, clinical, ownership, compliance, everybody, operations, to just have a roundtable meeting for an hour twice a week to start fleshing out what we were going to do. And I'm sure everyone can remember, in the beginning, it was this kind of nebulous. I mean, we're used to it now, but it wasn't sure if this was going to be nothing or was it going to be, the end times. And so just on a lighter note, I kind of remember in those early days, I told my owner that I was on the side of the skeptical side in the beginning. I thought maybe this was, a little bit extra. We were getting a little extra with the preparation, but in retrospect, thank thank God that we mobilized quickly. And I think most places, most facilities that I've talked to where they got ahead of it had better success than those that hedged their bets. So, I mean, that's the first thing, and that's something you really plan for. But I guess my experience was that the more faith you have in being prepared as opposed to hedging your bets, was really something that was a learning experience for me. Everything is a cost benefit thing, but with pandemic, it's just such a, it's like, knock on wood, hopefully once in a lifetime thing. But it really seemed, we do for our operations like an HVA analysis, and, you sort of risk assess, tornado based on where you are, and just pandemic was up there with like a zombie apocalypse. It seemed very,
Right.
very, very low and very unlikely. So who knew? But, I don't want to repeat a lot of what Brian said. Brian had a really good breakdown there. We had talked before. We had a very similar flow. That was the basic framework, was to set up a work group and then encounter every hurdle and then workshop it as we went. And they really kind of came down a few. There was the main focus, obviously, is client care. That created quickly a lot of unique issues. I think because we're outpatient, that one of the biggest things was once about the third week of March, we eventually had to shift to completely telehealth. Mm-hmm. At the end of that journey, I'd say outpatient IOP treatment is not very conducive to telehealth. As I mentioned, we have a mental health license, and on that side, one-on-one clinical care works pretty well remotely. But trying to manage running groups and all the various things that come with that in a sober living house, it created a bunch of logistical hurdles that we didn't anticipate. And if in the future, I don't really know what we do if we we're in a situation where we were mandated to be locked down for a year or something like that. I find our experience was that outpatient care would be really difficult to honestly and ethically deliver a high quality care, remotely. So we still have a little trepidation about, what happens if this turns backwards again. One thing I jotted down as a note was for urinalysis for drug screening. We have, it was a task that we didn't think about that remotely became very difficult to do from a telehealth perspective. We came up with some novel solutions where we would have swabs for our we manage sober living, but we also have non-housing clients that are just at their residence. We would mail them a swab and then require them to create an account on the telehealth portal and get on video and administer the swab on video in front of the medical staff and then seal it and mail it. But even with that, it just created a liability blind spot where we still couldn't guarantee what they mailed us was not tampered with very effectively. And now our medical staff is, concerned about what they're signing off on because of that. And, just problems like that would come up and we would think we would have a solution and then we would note something. So I could go on and on about the clinical side, but then there's also, as Brian mentioned, the staffing side. We had a lot of issues with burnout. We had a lot of issues of navigating quarantine rules, revamping our policies and procedures regarding, someone had a wedding they had planned to go to on staff and they want to go to one of the states that's, on New Jersey's block list. Do we make them take all their vacation time, quarantine for 2 weeks? People were very upset. People had, honeymoons planned. It was very hard to navigate the work-life balance. Also, childcare was a huge factor for us, for staff that have children at home and now are required to have their children educated at home. Some jobs are doable remotely, like my job. I was lucky. I was able to, working on policies, procedures, I can do that anywhere. But if you're a clinician, as much as we want to support you, you can't really do your job effectively from home, and that became a really tough balancing act. And
can I ask a little bit more? I'd like to delve into the questions about telehealth some more. Chris, Can you talk about, if I remember correctly, you no longer are doing groups remotely, right? You've been able to bring them back.
Correct.
And can you talk a little bit about the issues that you found doing groups via telehealth? And then Brian, I'd like to turn it over to you and talk about, because you are still doing groups remotely, and any tricks that you found that help make it better. So Chris, can you delve into that a bit?
Yeah, sure. And I think also for context, I'm not sure where everybody attending is from, but I'm in we're in New Jersey. So we were the early wave. So again, we were lucky that by June, we were coming off a lot of the high risk lists. We did a lot of early lockdown here. So we came back actually by June to on site. So March, April, May was entirely telehealth. We have about 7 or 8 sober living homes where I'd say about 75 to 80% of our census are in the sober living home, and then about 20% are just non-housing. Each of those houses, we just had them, normal process, wake up in the morning, and on the flat screen, we would set up the Zoom, just like an remote AA meeting or something. We would do the groups there. But it just created a lot of, I think like the UA process was one that I mentioned. But also, they burned out really quickly. Something about just, the routine becoming, sitting in the living room. We started to have people, focus issues and people being on their phones. And then we're getting into micromanaging, okay, now you can't have your phones. Now people want to leave. And then you start doing that game. Or technical issues. Some of the houses were in areas that didn't have as good Wi-Fi. And now we're, struggling to ramp up the tech support. When we're not remote, we only had, we have one tech support staff here on site because it's not that heavy of a lift. But all of a sudden now, we needed an army.
Right.
And they were quickly overwhelmed. So I'll pass to you, Brian, but that's like a quick snapshot of some of our problems.
Well, and I'll just ditto, because we had all the same problems. And we had technology is that was a big challenge. We had to set up media rooms in each of our sober living houses, and with the idea that we would have everyone sit in a room together. And what we discovered is, after we spent quite a bit of resources creating media rooms, is it's not necessarily a good thing to have everybody in a room together. And so we've gone back to having individuals log on to the Zoom meetings via their phone separately, because it was difficult to keep a group's attention when you get together. One of the things that has changed is we've had to increase our staffing pattern with intensive outpatient treatment, because you're doing over Zoom. You have to have someone that's presenting, but you also have to have someone that is managing the clients and keeping an eye on the clients. And we have a system in place where if we see them drift off or, stop paying attention, we'll send a message to them. Are you still with us? And so there's a lot of those kind of items that we've had to incorporate into the Zoom. Also, it has to be somewhat entertaining to maintain their attention. And so we've had to go through all of our groups and, add YouTubes and make it more entertaining, or we'd lose them. And so it is absolutely an art to keep people's attention over a Zoom call. Yes, Chris.
It's something you said just reminded me, Joanna, of another point. So we were kind of talking about the current census, people that that were rode through the initial storm, but something I didn't mention that came up with the tech was new admissions. So as time went on, what we quickly realized, we had to revise our admissions procedure, our pre-admission procedure, to include tech competency and also access to tech. So those are two blind spots that we didn't realize that with our clientele, even so first was, for say older clientele, tech competency was a barrier. where, being on Zoom, like the younger population adjusted pretty quickly. But if you're in your 60s or 70s and, now older alcoholic, it was really a barrier to, with all the other barriers of willingness to treatment, it was like just another big one. And then we had the secondary level of, even if there was the competency, was there access? So a lot of our clients coming right out of residential or partial care, they have a burner phone that, they have to be on Wi-Fi. And now do we give them access to the Wi-Fi? Then that's overloaded. And then they're using the Wi-Fi all night and, setting up meetings with the dealer and all this kind of stuff. It just really, it was this whole blind spot of tech that came out with the admissions process too.
All of those things we've experienced. It sounds like we're having the same experience for sure.
But you don't have a choice, Brian, being in Texas, right?
Yeah, we're winning as far as COVID is concerned, which is not a good thing to be winning at. And so in the counties that we're in, they're hotspots. And so we cannot go back to live sessions at this point.
Wow.
But this is also interesting. This is interesting. And Chris, I think you had the similar thing, is our intensive outpatient, we actually have more clients over the last 3 or 4 months in the history of our intensive outpatient program.
Mm-hmm.
And so our census has actually increased dramatically since the onset of COVID.
Can you talk some more about in each of the different levels of care, like what impact has the pandemic had on residential, or you just mentioned IOP admissions are up, and also on how long they're staying in treatment or in sober living?
And that's another issue is with our sober living. And Chris, you have the same, you're experiencing the same thing. Is our sober living? We're full. We have waiting lists in our sober living. People are staying longer in living, and we have people extending month after month after month. And we've never seen that pattern. Usually people are trying to get out of sober living as soon as possible, but now we're getting people that want to stay. And some of that is related to, families are reluctant to let them move back in their home because of the potential COVID exposure. But it's interesting that in our sober living and intensive outpatient, we have seen a dramatic increase in ADC since the onset of COVID. Residential's been kind of up and down. We had that initial drop off that I referenced earlier, and but now we're pretty close to being back to a normal ADC in residential treatment.
Yeah, I pulled the numbers this morning, Brian, and we had a big dip in April.
Yeah,
and,
that's when
I don't have actual evidence of why, but the anecdotal evidence that we've kind of pieced together is that fear that I referenced before, is that there was this initial sense of nobody knew what was going on, and I think a lot of people just froze. Yeah. But then by May, our ADC jumped back up, leveled, and then actually has been up.
Right.
So are you both doing okay financially then, if volumes are up and length of stay is increasing, or have your costs risen to more than compensate for that?
Well, that's we did do the PPP loan, and that was a significant help. We've had to, because of the anxiety levels with the staff, and what I referenced earlier is we've had to overstaff, and the technological challenges with outpatient needing more personnel on board when you do groups so we're overstaffed. So it's been a challenge to do that, to realize that, hey, I need to get more support when you're seeing your revenue go down. And our biggest revenue source is our residential treatment. Mm-hmm. And so even though our outpatient services were up and revenue was up there, our residential services were down, and it has more of an impact. But we still had to go ahead and do the overstaffing because that's what we needed to do. And so that was a difficult decision and action to take, knowing that financially, you're not doing as well, but we're going to go ahead and add all these new staff members. So it was a difficult decision.
Yeah, I think I can echo that. We don't have the residential piece, but I would say revenue is not down. I don't know. Maybe we need a little more distance to see comparatively. Maybe next year I'll have a better idea, or quarter two of next year we'll have an idea. But it's kind of nebulous to add up all those ancillary costs. Even just time. The amount of mental energy that may have indirectly affected burnout and turnover. It's not a direct correlation that we can tie together, but I think it is a big factor that it may net out to a negative.
Right.
But on paper, I don't have a clear answer, but it certainly has been a cost that is hard to quantify because of all these facets that we're talking about.
Yeah, and
go ahead, Brian. I'm sorry.
And there are increased costs. It's not just staffing. There's all the precautions that we have to take. We quarantine for our residential services offsite, and so we had to staff a whole new facility to be able to quarantine before they could get to our main campus.
Wow.
So there are additional costs, and the supplies that are needed. The mask, everything. And so the cost has been profound.
Yeah, I was going to say a small one, but we provide food at all our sober living, and that definitely spiked. A lot of little things like that, toiletry, toilet paper, paper towels, like they're not going anywhere. So it's been astronomical, the increase in all those little costs that we normally don't look too closely at.
So let's start. One of you mentioned that it's been really difficult with your staff. I think it was you, Brian, that you're seeing, a lot of. Actually, I think you both mentioned it, Brian. I think you said that, you're seeing an incredibly high level of stress among the staff. And can you both talk about how has this impacted on turnover? I think you mentioned, Chris, the challenges of people dealing with homeschooling of kids and stuff like that. Have you come up with any solutions that have helped to support your staff during these times?
I can speak. I think what the delineation for us was between what jobs can be done remotely. We were deemed essential early on under New Jersey law. So all staff was permitted to travel and come here even during lockdown. But we wanted people to stay as distanced as possible. So that was step one, was like whose jobs can be done completely remotely and what can't. But then we logistically had to, again, cost benefit. We implemented a process of tracker, like a work from home tracker system, where all, clients, staff that was working at home had to account for their day. And that was a sensitive thing because, we're, as opposed to being laid off, which is happened to a lot of people were grateful to be working, but then it got a little bit micromanagey and it got tense on already tense times. People felt like, sort of micromanaged, but there was that fear that, we would have people sitting around watching TV for 8 hours, and clocking in. We really had to balance that sort of, tough, sensitive situation of trusting our staff versus having some accountability piece. And then we did little things. I think I mentioned when we talked privately, we did a little stipend for anyone that had children, school-age children or young children. We did $50 a week for every staff member, not as, just as almost like a bonus. So that would help with childcare. As anyone with kids knows, $50 isn't really that much of an impact, but it was about what we could do. without, and so that was appreciated. We tried to do wellness check-ins. In the beginning, we were a little better about it as it went on. I think people kind of wanted to just manage that on their own, in their own way. And then our direct, like our tech, or we call them PRS, peer recovery specialists, that's where we saw the highest level of burnout, because they were essential and had to be on site in the sober living and doing transport. And we saw a high amount of turnover. And it became hard to fill those positions. So then, kind of like Brian was saying, now we have people working 15-hour shifts and we're paying overtime, and we're begging those people to please stay, we need you to stay. People that were experienced, we were getting to that point of worrying if we lose our experienced staff, now we're in a training nightmare, so that's kind of my perspective. How about you, Brian?
Well, all of those things again. In the very beginning, we developed a staff health tracking system, which involves any type of illness, if there were any COVID positive, if they were having overwhelming stress levels, and with that, we established a very important principle. And the principle is to, when you're interacting with staff, is to be very sensitive and compassionate with what their experience is, and not try to, push them into areas that at the moment they don't feel comfortable with. So just a very compassionate, caring interaction with staff. So for example, if I had a staff member that would come and say, I'm just really stressed out right now, is to hear that and say, what can I do to be helpful? Do you need to take the rest of the day off? And really incorporate that approach. And that's worked very well. A big part of, on top of what Chris said, a big part of what we're also doing is making sure that staff are taking appropriate time off. We're really pushing people to take vacations, which when you're having staffing issues, that's a challenge. We have had people. I had a case this week with a staff member that she was just so overwhelmed, and I said, "Okay, well, you need to take off for a week," and we have her off. Now it puts a lot of the rest of us in a precarious situation because we're having to cover for her, but we have to be very sensitive and compassionate with staff. We've also done things like Chris mentioned, is we sent out to all staff members a COVID relief package, and that was financial to support them during this time with childcare, groceries, etc. And we also got a very positive response from the staff for that. And we're on the second round of that right now. Is we're trying to do individual. That was for all staff, and everybody got the same. But now we're trying to go staff member by staff member and doing something special.
You're already doing better than the federal government, right?
Right. Well, and I'll give you an example. What I did with 2 staff members last week is I sent them to a spa, an all-day spa event, and those kind of things are invaluable. They just really appreciate it, love it. So we're trying to do individual staff members by doing things like that, just to keep the morale positive, and so far so good. It's having a positive impact.
So I know we're almost at the end of the time. I wanted to ask just real quickly, are there any positives that have come out of this? Brian?
Well, the thing that, and I referenced it earlier, the thing that was so unexpected is this process that we have with family members. This weekly meeting that we're doing with family members has just blown up. And we have people that don't even have clients in our system that come to this family program. And it's open for anyone. And it has turned into this beautiful, oh my God, it's just wonderful. And it began, what I said earlier is all the focus was on COVID, and now we have all these family members supporting each other, and it was totally unexpected to have such a success with a Zoom format. But it's great. There's several positives that have come out of this situation. That's just one example.
Yeah, I think just to keep it short, two examples for me.
Chris, how about on your end?
One small micro example, our logistics. I think the biggest thing that changed for us was get comfortability with these meetings like this. Tech really changed the game for us. Before, you would have sometimes these Zoom type meetings and people didn't like them, and it's just really revolutionized the way we do business in terms of meeting flow and time management. I think I said to you guys before, there's no longer that 10-minute, 15-minute shuffle into the conference room and people getting coffee. And so that's weird. I didn't anticipate that one, but it's changed our workflow. But on the macro level, I think the biggest positive for me that we saw is that recovery is still happening. That there was a lot of doom and gloom that this was going to be, the end. And the clients that have the willingness, it's still there. And, it's almost a lesson within the context of recovery that, like, we're not going to let this stop us either. If you're ready and willing, we can figure out ways to work with this. And that's really beautiful part of the industry that we're in, is that it's, there's logistic hurdles, but it's for a really good cause if you have the passion. And I saw our clients like rise to the occasion, which was beautiful.
Fantastic. Glenn?
Excellent. Thank you guys so much for doing this. I have a question from the audience, and it says that considering all the information that you provided about what you've done over this time period, how are you using this information to prepare for 2021? Oh, by the way, you have 2 minutes each.
Oh, okay. Chris, you may start.
All right. I think first praying.
Yeah, right. Please help us.
Everybody wear masks so we can get through this.
Hey, Brett.
But I think logistically, kind of what my last point about the positives, it's really informed our systems, quickly analyzing workflows, like a quality improvement, quality assurance approach. We learned to adapt much more quickly than we had in the past. Like, where there'd be 3 or 4 meetings and a task could linger for a month before we actually affect change. I think it taught us how to really move on the fly and not micromanage, change. So for next year, whether we're out of this or not, I think we really built the muscle mass to move and pivot and react and not end of the world type feelings. We're much more grounded in that this is manageable. So I feel no matter what next year serves up, that we have a system now, a logistical system to handle
it. When this thing first started, my thought process, and not just me, but several people it was, we just need to hang on through this and make it through this and get to the other side. And so it was as if we were just holding our breath until this thing blew past.
Mm-hmm.
Well, obviously that wasn't a good strategy, because it hasn't passed and it doesn't look like anytime soon it's going to. And so we've shifted our perspective in that this is the new norm.
Mm-hmm.
And so we need to learn how to do treatment in this type of environment for a long period of time. And so we don't have any plans as far as like going back to live outpatient services just because of the numbers in Texas. So our objectives, our strategy is to move forward with our new structure. And it's interesting because last week we started doing budgets for 2021. And I said to the stakeholders is that, it's hard to predict because none of us know what's going to happen. And so we have to be very flexible in the future, is because nobody can tell what's going to happen, how this is going to go. So we need to be very flexible, and we need to move with the current state of affairs. And so that's our philosophy is we are in the new norm now. And so we're going to move forward with this new norm.
Right on. Well, thank you guys so much. Joanna, I appreciate your work in crafting the panel and offering the questions. And thank you guys, everybody, for being a part of this and really, bringing up these points and walking with us all through this because it is such an interesting time. It changes almost daily. And so thank you guys for this. I appreciate you being a part of this event. And so with that, we're going to wrap up this session, guys, and take a quick break. We have our closing ceremony basically after this, okay? And we're going to go through some thank yous, but we're also going to announce the winners of our wonderful contest. We're going to give away that 3-night stay at the Breakers. But with that, thank you guys so much for being here, and
Thank you.
Thank you.
All right, take care.
Thanks, everybody.